Hello everyone, I'm Julien Magne from Limoges in France. I'm now at the ESC in London with Dr. Mathias Buron from Copenhagen in Denmark, and we will talk about his very nice study just accepted as abstract, an oral presentation in the final of the Young Investigator Award. So Mathias, it's my pleasure to be with you, and I would like to ask many questions. But to start this interview, could you just please summarize what are the main findings of your research and what are exactly the population that you have targeted and the main objectives of your study?
Yeah. Thank you, Julien, and it's a pleasure to be here. My main study population was that we used nationwide registries in Denmark encompassing 50,000 patients with aortic valve stenosis. And we assessed using pharmacy prescriptions. We assessed the effects of aortic ACE inhibitors and angiotensin receptor blockers on the outcomes of overall mortality, cardiovascular mortality, and the occurrence of aortic valve replacement. And our main findings of the study was that receiving these medications actually had a protective effect with regards to both overall mortality and cardiovascular mortality as well. And it actually lowered the risk of having an aortic valve replacement as well.
Nice, very nice. And could you mention us what are the aortic stenosis severity? Do you have the information of the severity of the aortic stenosis?
That's a very good point you're raising, Julien, because seeing as it is an observational study, it is an inherent limitation to the study that we don't have information on this. We tried to circumvent this by making another sensitivity analysis where we used the average dosage of loop diuretics, which are previously used as a proxy for the severity of heart failure. So how much loop diuretics do you need in your everyday life? And when stratifying by this, we saw the same exact effect regardless of the required amount of loop diuretics. So of course it's not as good as if we had the exact echocardiographic data, but it seems like it is independent of severity.
Yeah, of course. I have had the opportunity to read your abstract and to see your presentation. Clearly the results are very promising, but now what will be the clinical implication of this result? How do you change your practice, or how your group will change your practice according to these results?
Well, in general, these results are in a group. It's a longer process because in recent years, ACE inhibitors and receptor blockers have been deemed more and more safe for use in patients with aortic stenosis. Previously, they were considered contraindicated because you had a risk of hypovolemia in these patients. But this is just another step in the process towards regarding these drugs as safe. Of course, it is an observational study, so it can only be hypothesis generating towards maybe there is a use for these drugs someday. It looks like they certainly are beneficial for mortality.
And could you try to make an hypothesis on the impact that ACE inhibitor or ARB maybe have on aortic replacement protection? Is it a regression of the progression of the aortic stenosis severity, or only a protective effect against symptoms and against LV dysfunction, or both? Maybe?
Yeah. Well, the animal studies are suggesting that it is not a regression in the damage if it has already been done, but it will slow inflammation in the myocardium. And the main hypothesis is that is actually why it is beneficial towards lowering mortality. It is because it reduces myocardial fibrosis, improves left ventricular function, or sustains left ventricular function, and also reduces the calcification of aortic valves. So it is actually anti-inflammatory. Is the main reason.
Okay, and what is the next step now regarding your research?
The next step, we have shown these in an observational study that there is probably a beneficial effect, and it seems like we underline as well that ACE inhibitors and receptor blockers are safe for use. Yeah. But the next step is of course a randomized clinical study. And there is to date no studies assessing this, so it will be the next step in improving the prognosis for aortic valve stenosis patients.
Yeah, clearly there is now place for a clinical randomized study regarding this treatment. So thank you very much, Mathias. I will encourage everyone to go on the ESC website to see your presentation and to read the abstract, which is very, very interesting. Thank you very much, and good afternoon.
Thank you.
Thanks.